Hi, my name is Allie. I have Raider here today. He's 8.5 years old, and he has had a chronic right leg limp for the last 7 years or so after a bale of hay was dropped onto him. I've seen multiple different doctors about what was going on. We have never really landed on a diagnosis, but we're trying acupuncture, and it seems to be working very well. Dr. Kim Luikart. We're going to be doing some acupuncture today on Raider. This is his 4th acupuncture treatment. As Allie explained, he's had some chronic lameness in his right hind limb here. We've never found a good explanation for it. We think he probably has a chronic neurologic issue, a pinched nerve or something like that. He's done really well with his acupuncture treatments, and we're going to show you that today. There's a few things that we do whenever we're getting ready to do some acupuncture, and the first thing I start with is a myofascial exam. So basically I'm going to go through, I'm going to palpate all the muscles in his body. Dogs with chronic lameness very commonly have tight, painful muscles in other areas of their body. If you think about a dog walking on 4 legs, if he's not using this leg very much, he's going to be putting more weight on his front legs. So these dogs will often have sore shoulders and sore backs. Raider has, in his history, had some pretty tight bands here in his back, in his thoracic and lumbar spine region, so we usually will treat that for him. And we treat his back leg also. Okay, so often what I'll do is I'll look for a tight band of muscle, and sometimes in those tight muscle bands you can find what are called trigger points, and humans get those too when they have painful backs. But releasing those tight bands with the acupuncture can make them feel a lot better. So acupuncture really targets the nerves, the blood vessels, helps to stimulate blood flow, decrease inflammation. It also releases some of the body's natural endorphins. So there are very specific points that we use with acupuncture that relate to specific nerves and specific areas of the body, but we also will use some of those tender points and place needles in there. Most dogs respond to acupuncture very well. Some dogs are a little bit more sensitive than others. Raider's always been a very good patient. I don't know if you can see, he does have a little muscle clenching when I put some of the needles in there, and that's a good thing. That means I've probably found a spot that's a little bit tender. And that's what we're looking for. Good boy. So we really use a scientific approach here when we're talking about acupuncture. Like I said, I'm looking for areas with very specific nerve innervation, areas of muscle tightness. Trying to give some relief. And since we've been doing acupuncture on Raider, I believe Allie told me he's really not been limping much. Is that right?
Yeah.
Had a really good response to it.
We go on hour-long hikes, and he does not limp at all afterwards.
Fantastic. And I've even been able to get him off of the anti-inflammatories. That's great. There are lots of well-known points for acupuncture. This one up here is kind of known as the relaxation point. There's a lot of crosstalk that goes up here with some of the cranial nerves, and it talks to the brain stem. And in some dogs, can result in pretty good relaxation, huh? Good boy. Doing some of the points up in his neck here too. This point here is kind of the top of where the sympathetic nerve supply begins in the body. We think about the sympathetic nervous system. That's more of our fight or flight response. And some dogs that have chronic pain, that whole nervous system is a little bit amped up, and we're trying to bring that down a little bit. Again, increasing relaxation in them. Back here, I'm working on some of the specific nerves that are associated with his back leg and his hip. It may look sort of random, but I'm actually feeling for some very specific landmarks with his hip and his leg. And I'm thinking about specific nerves that I want to target as I go along here. Typically, once we get the needles in, we'll let
let them sit for about 15 or 20 minutes. In some dogs, we also do what's called electric stimulation with them, where I hook them up to a very, very mild electric current, and that actually helps to stimulate the nerves a little bit more, as well as release a variety of different endorphins and natural opiates in the body. Okay. One more, and then Rita will just hang out for a while. As you can see, he has some mild response in a couple places. It's more of a tickling, feels kind of funny, but he handles it very well. Good boy, Raider. And that's Acupuncture today on Raider.